Welcome to Healing with Heart. Simple ideas for profound healing. These videos are meant for informational purposes only, not intended to diagnose or treat medical conditions. Hey guys, Dr. Martin Hart here. Today I just wanted to take a little bit of time to talk to you about what we might actually learn about treating Lyme disease from Alcoholics Anonymous. Now, what am I doing talking about a recovery group for alcoholics who drink too much booze, right? Well, I used to read these books by a psychiatrist who was really into functional medicine and orthomolecular medicine back in like the 60s and 70s and 80s. And he was a big fan of the recovery groups for his patients and 12-step groups as a way to grow spiritually and mentally and emotionally. And so one of the concepts that was really talked about in that sort of circles and those recovery groups was the idea if you're an alcoholic, you can't just take away the booze and expect to get better, right? You'll get sober, but you don't actually get better. And then most of those people will fall off the wagon, so to speak, right? They'll get worse. They'll have a relapse. Why? Because they didn't change their life. They didn't change anything that actually made them want to drink or made them an alcoholic. The same thing is true for Lyme disease patients, okay? But you just supplant the bacteria for the alcohol. You can't just take away the bacteria and expect the patient to get better because you're not taking away what actually made them sick in the first place. You're not changing anything about it, right? Why do some people get sick with Lyme disease and some people don't? Why do some people, when they get infected by Borrelia, they end up with years and years of sickness and other people don't? Because of what's going on in the rest of their life, because of what's going on inside their body. And so we have to look at it like that. So in the 12-step groups, an alcoholic takes a holistic approach, right? They change their spiritual state, their mental state, their physical state. So they become a whole new person who's no longer an alcoholic. Okay, they no longer need the alcohol. With Lyme disease, we need to do the same thing with patients. We need to do the same thing if you have Lyme disease. We need to change the rest of your life. You know, are you eating toxic? We need to clean it up. What's your environment like? Do you live in mold? Do you use chemicals that are toxic to you? We got to clean those up. More importantly, what's your emotional state? You know, do you have wounds from your childhood that we need to clean up? Do you have relationship issues that need to be corrected? All of these things are going to be a factor. And if we don't address them, maybe we can clear the bacteria, but you're going to end up sick again. You're going to relapse, just like an alcoholic, okay? We're going to relapse with something else in your health. So I want you to take some time after listening to this video and think about those things. What in your life needs to change so that you're no longer a person who gets sick with Lyme disease, right? What pattern needs to be different? And we can think the 12-step groups were inspiring that line of thought, at least for this video today. Comment below how you've changed the rest of your life to keep you from being a Lyme disease patient, and share this video with anyone you think would be useful. Take care.